situated here. All right, I see the recording has started, so it looks like that was successful. We're good to go. All right, well, good morning, everyone. My name is Katie Gordon. I'm with Public Consulting Group, and if you're not talking, if you could mute, that would be wonderful. We appreciate that. So I am here today with Jeremy. We'll introduce ourselves once again in just a moment. Jeremy Thomas with Public Consulting Group, and we are going to talk with you about our work with the CIHS rate study project. We're going to review the mechanics of the current model and our initial model enhancements. So our agenda overall today, we'll talk about the project timeline, our approach to the review, some model updates, and we'll talk about next steps. And please know that throughout our presentation, we're very open to questions and thoughts and comments while we present. We'll save time at the end for questions and answers, but if a question or a comment comes to mind while we're talking, please just raise your hand or put something in the chat, and we're very happy to address that as you raise them. All right, so like I said, my name is Katie Gordon. I'm with Public Consulting Group. I'm the project manager for this scope of work. I'm joined today by Jeremy Thomas. Jeremy, if you want to introduce yourself.
Hello, everybody. My name is Jeremy Thomas. I'm really excited to be on this project and getting to talk to you today. DCYF is very close to my heart. I started my career working in forecasting and rates for the Department of Children, Youth, and Families. Well, actually for DSHS, and then saw the merger into DCYF, and then decided to take an opportunity working for the consulting firm for a bit. So I'm really excited to be here today to talk to you about rates.
Thank you, Jeremy. All right, and then Amber, I should have cleared this up before we started the call, but would you like to introduce yourself and your team? Or do you think folks are already familiar with you and your team?
I think folks are probably familiar with us. We're here, and in lieu of the time, let's just get rolling. Thank you.
All right, okay, fair enough. All right, let's dive in. Okay, all right, so our project, PCG's project timeline is on the slide here. So we have 4 deliverables that we owe to DCYF. The first one is a project plan, which is done. The next one, the most recent one, is an updated CIHS model baseline. And as you can see here, that was due just on Friday. So we turned that in on Friday. But the next piece, or the next deliverable rather, that we owe will be more substantive, and that's the updated CIHS rate model workbook. And we owe that to DCYF mid to end of July. And then lastly, we'll put together a rate model and summary of recommendations moving forward, and we owe that to DCYF by the end of August. So that's our overall timeline and our overall scope of work. And here we wanted to share our overall approach to rate model review, right? So our core tenets include rate model should support program goals, right? So we want to identify the changes to a rate model. We review those changes for balance among 4 key considerations: cost, quality, fairness, and simplicity. We gather data for updated cost considerations and benchmarks, and then we conduct an iterative review. All right, so that was me talking at you. So now Jeremy's going to share more of the substance, and so I will pass the mic over to him.
All right. Thank you all again for having us today. This is super exciting. I love doing this work. Like Katie had mentioned, the project, or the deliverables for this project, was to develop a baseline, which we've already submitted, which is a single model. And so that is based off of the model as it's already been developed, and we're still working with DCYF on the finalized individual model. So this is where we get to talk about what those individual models are, how do we build them, and how do we frame that work that we're going to be doing. Just to give you a little hint at the future, they're actually planning on sending out some of those model assumptions or a cover page out to all the providers after we've concluded this work, so that you all can see exactly what's in the models and we can have a feedback dialogue after that. So really exciting to go forward, but I think it's really helpful to understand all the components of a model so that you can kind of know what you're looking at. I know many of you all have been doing this for a really long time and probably have this intimately known, because this isn't a new process, but some of you might be able to get a little more familiarized with it as we go along. So I'd like to start by starting all the way back and talking really quickly about pro forma modeling. So all the modeling that PCG develops, this is not only just in combined in-home, this is the same structure that works for BRS. We also have some of these in other settings as well for therapeutic foster care. So these models essentially take all the components of what you need to pay for and put it together in a pro forma or ad hoc model that puts together all the pieces that you're going to pay for and then takes that budget and then splits it out amongst the people that you're going to have to pay for. So just to use this as a general model, take the annual families served based on the caseload or service duration. Then you add up that personnel, all those costs for personnel. You take tax and fringe and all those additional things you need to make sure you're paying for and covering, put those all together, then that's your personnel costs. Then you grab your operating expenses and put those all together. They're as they are per family, right? So this is always just back to that basis of per family or per case. And then at the end, you take it, you split it out, and then you have a per person or a per service line. So that's the general model or the general framework that we use. You can see that over here. We're going to kind of walk through each of these components individually. So if you want to go ahead and move to the next slide, please. So continuing to think about this, the current models, and then we'll put this will bring us towards this combined in-home space. The current model is built using a number of variables. The effort here is to quantify the total workload for each service. So when we're taking that very first component, right, what is the number of cases or how does that work? We want to be able to pull that apart and really understand what is the caseload per therapist? How long is a service? How many families are served within a service? Is it one, two? Is it multiple? So really being able to tease out those pieces, understand how much contact time there is, all of the clinical hours, how much child welfare involvement you're having to do, and then even all those other EBP specific case-related supplemental family supports that you have to do. So when you take all of these components, you're able to see exactly how much time that service is required over the duration of the service. So that gets us our basis of time. That's that nugget of what a service is in that service definition. So now you need to build around that service how much of the various things you need to be able to pay for. Next slide, please. So the main element to any model in a rate is always going to be staffing. So once you know how much of a service you need, oh, yes, thank you. That was the kind of overarching list, but thank you very much, Jill. I will make sure to hone that the amount of training is definitely a part of this, for sure. So when you're building your rates, the personnel is the main cost, right? It's the person doing the service. And so when you're building it out, we think through the combined in-home model, particularly around three main drivers: therapists, supervisors, and leadership. There are other components that are included, but the main focus really is those three, right? You have some other pieces, and we'll get to those here in a little bit, but that's more of the specifics. But when you're thinking about the therapist is the basis of the service. So when building out a model, you always have to have that touchstone. So we've touchstoned on how much time it takes. Now we're going to actually build out how much time it takes for the therapist to then do the relative ratios beyond that. So when thinking about the therapists, assessing the following variables, we want to think about that EBP contact, how long it takes to do that, how many clinical hours is required, what kind of travel hours are necessary for that service, those child welfare, annual case hours, and of course, like Jill mentioned, we're missing from this one too, the training. So all those pieces come together to be able to understand per case how much time is the therapist spending on those. And that research has been done, right? And so that's being worked on and considered from a number of variables and always kind of always thinking about those elements as well. So once you build up exactly how many, then you can then assess how much of a supervisor's time and how much of the leadership time around that. So the models currently, you can do it a number of ways. Some models do a direct calculation of how many hours happen per service. But for these models, and really to create nimble and dynamic models that are able to be updated easily with very few errors, DCYF has chosen to go with a ratio model. And so by using those ratios, it's 7-to-1 supervisors to direct care staff, and it's 14-to-1 for the leadership to direct care staff. So that produces the framework of how many FTEs or how many hours you need to be able to put per service in that time. All right. So next slide, please. So once you've developed how many hours you need, you know your hours for staffing time, you can start to tie those in using direct calculations. The next thing is you need to say, all right, so how much are we going to pay per hour for those service costs? And so again, sticking with that same model for efficiency and for the way the model can be built and updated effectively, DCYF chose to benchmark all of the wages to the direct, well, not all, but to benchmark these major wages to the direct worker wages. So in order to do this, DCYF and PCGs had many conversations about the different ways you can approach this. I think the first thing to introduce everyone to is Bureau Labor Statistics. Bureau Labor Statistics is the foundational wage data set for the United States. We use this in projects across the country in multiple settings and in multiple different kind of structures. And so being able to identify a wage and how much that wage is paid on general is really hugely important, especially right now while wages are changing so quickly. So states are starting to look and really dive into those. Now, there are particular positions, they call them occupation codes. And so when looking at these occupation codes, selecting the occupation code is really the work, really trying to figure it out. And so when looking at this, there's a suite called the 21/1000, which is counselors, social workers, other community and social service specialists. When you pull into the data, you'll be able to see below that each of those has its own line item, but there's a lot of variability with those line items, especially when looking at regional data. So looking here and trying to understand exactly how those codes work out, it really became clear that the best pathway forward for DCYF was to use what is often called a super code or a category code. So we're using that summative code of all the averages of all the averages of counselors, social workers, and other community social service specialists all together. So in doing that, it's a fantastic opportunity to have some normalization. So, but we do see some variance in the wages of the models. So while I'm trying to create a common thread, that using this code for all the models wouldn't work if you're using the exact same benchmark. So when these data are appropriated or delivered, they have percentiles. They range from the 10th percentile all the way up to the 90th percentile, or total, right? The max and the min, really. But when you look at these, we were able to take these and say, well, let's keep the same thread because the work truly is similar or consistent. And let's look at the requirements for each of the programs or the services. And then we can then split out the services by their educational and or experiential requirements. So looking at that occupation code, starting at the lowest requirements of a high school plus some work experience, that would be a 10th percentile wage benchmark. So if you take all the different people who reported the wages for this category, it's the 10th percentile towards the bottom, all the way up to the licensed professionals who would be in the 75th percentile. So being able to pull these and assess these really quickly and efficiently has been incredibly helpful in a number of projects across the country. And so DCYF is taking this to continue this work. So it's really helpful. So now we have our benchmark, right? We have our direct service wages, which is the kernel of how much you're going to pay per hour for these services. All right. And then moving on, you want to then say, oh, next slide, sorry. Then moving on, you want to think about the salary variance within those main positions. So in conversation, again, this can happen a number of ways. You can try to pick different BLS codes for program leadership or for supervisors, and those can be really helpful to be able to identify. There's not a lot of nuance between the positions in BLS. So one of the ways, yet again, DCYF is really trying to be forward thinking and say, The kernel is this social worker, and then everything around it would then be on a spectrum or on a variance slide. And so you create the program leadership would be 15% of, or sorry, the supervisors would be 15% above that base level or the therapist average, and then the program leadership would be 15% above that, creating very clear pathways for those payment structures. We'll obviously have to pay for other positions in here. So for example, we put the admin staff here. This one, we have really good data on how much those are being paid currently. And so we're using that tier 1 provider data, but we're still doing a few assessments on those additional secondary positions just to make sure that they're truly paid their full wage. We do recognize that in studies that we're doing across the country, we very often see that the positions that are the lower paid positions like admin staff are seeing the greatest increases currently. So we want to make sure we address that in this study. So we haven't finalized this per se, but for right now, we're using that tier 1 provider data.
Can you clarify what you mean by the largest increase? You said for the, I'm not sure what you mean by increase.
Yeah, so as wages are increasing across the country for multiple positions, we're seeing that positions often needing the greatest increase are those at the entry level and or at the most specialized level of medical nurses and things like that. So they're seeing massive increases in the requirements to be able to hire those positions. So while BLS might have a code for what the average is currently being paid, that might not be enough to actually recruit and retain the workforce that you need. Thank you for that clarifying. That's fantastic. So once you've identified exactly how much you're going to pay per hour for all those positions, you need to add on all those extras. We recognize that there's a lot of costs, especially in a state like Washington, where you have high costs in general. So staff health insurance here right now, just to kind of pitch out what the current model does. Again, we're still taking a peek at these and making sure they're honed, but about $5,000 per year per FTE. We're thinking about 208 hours of PTO. So when we're building out our models, we have to account for those hours to be paid in addition to the work that they need to do. And then professional development costs at a ranging about 638 per year per FTE. Again, another one we're definitely looking into. But overall, these are incredible elements and definitely competitive from what we're seeing overall. And then I'm going to answer Molly's question. I see that travel time included in this model. Are you planning on including average travel time per case rather than continuing to pay actual travel time per contact? No. So we are evaluating how much travel time to pay for travel costs specifically versus the time it takes to do the travel. And we're trying to tease that out. That's actually one of the more contentious elements that we're working on right now. It's a tough thing with Washington having that additional actual travel time element. And so we're trying to make sure we bridge that in the data going forward. But we're not quite sure exactly how we're going to kind of finalize that. We can go into that at the next meeting, I'm sure. All right, next slide. Okay, so we know how much we're paying for staff now, right? We've added all those up. We've added those percentages. We've put in those extra hours. We have some really tough things. And so now we're going to talk about operating expenses. So what you'll see now is we're going to start thinking about this kind of splitting. So DCYF and PCG have methodologies to do this work. But I want to make sure I'm highlighting where DCYF is going above and beyond. So we don't often get to hear those stories very often about when states are doing that kind of next step. And I wanted to make sure to push that here a little bit and let you see this. So when we're breaking apart these additional costs, we generally do a direct tax and fringe percentage that is based off of some kind of benchmark nationally or regionally if we can find it. Sometimes we'll do additional research where we get paid to have a study and we'll do a full analysis of what the providers are currently paying. But it'll be one number generally. And then we will sum all of the operating expenses into one number and then have some kind of indirect calculation. So usually our operating expenses down below is kind of a basic model that we'll use, which is like insurance, program equipment and supplies, IT technology, occupancy, Translation, interpretation, service, fundraising, development, allowable, miscellaneous. I love that allowable miscellaneous category. It really drives me crazy when I have to get into data, but that's kind of the general structure of what PCG tends to do. And what we see on this right is what we're going to be breaking apart for DCYF and analyzing and making sure these pieces are correct, because these are all very specific and really thinking kind of about how providers or how the community thinks through all of these elements and trying to make sure that it's as comprehensive as possible. I really enjoy the addition of cloud services. I've actually made the argument to include cloud services on a number of rates and have been turned down. So I'm always really excited when I get to see that. And then also making sure we're really breaking out the different types of taxes at the bottom and really understanding how each of them is changing so that when something changes, those are easier to update because they're more precise and really making sure that they're covering all of those elements. Also, recruitment materials and ads, I love that as well. Fantastic. So really good job to DCYF on that. And I will be taking that to all my other models in the future. All right, next slide.
Question in the chat, Jeremy, from Allison.
Oh, sorry.
Oh, you're fine. Is the region, it's kind of to the last slide, I think, but yeah, is the region where the service is taking place taken into consideration for the amount paid per case? So
there's some regionality considered in these models. I think in general, the goal is to try to benchmark to a higher King County sized model, or at least adjust or relatively account for the King County size model. But right now, there is not a lot of regionality in this model, and something that DCYF is well aware that they should probably look into in the future.
Because I've been rate studies and everywhere, I think, right now with DCYF. And one of the programs for home visiting, not combined in-home, they do take in consideration their region. So I guess I'm wondering, within DCYF, why is there not a standard then? It kind of feels like each rate measurement is kind of a little different instead of uniform that way. So I guess you're saying it's gonna be kind of like at King County, but not really. So could you say that one more time so I can understand it?
I guess what I'm saying is that the current calculations take into account the higher costs of the King County region, but it's not necessarily benchmarked directly to King County. I think it would be really helpful, and I'm going to try to get in contact with the home visiting team and figure out exactly what they're doing over there so that we can make sure we can work on some of that alignment. I really appreciate that.
Yes, thank you, Alex.
Okay. All right, so this is what we're coming back together. We started with the PCG model, and then this is the current draft of what DCYF is rate modeling. You'll see here that we have some of those elements. Obviously, it would have been too large if we included everything, so some things are a little distilled down. But what you see here is in that column FTE per direct service worker, that is the calculation that happens in the very front, but behind we're doing all that other calculation to determine exactly how much time each position is required to do the work. And then those are calculated in relative nature to that direct service worker, right? So it all goes back to that one, that's that very first direct service provider. Those costs are then calibrated and connected to the wages for each position, and then calculated the total yearly cost in that yearly column. So now we have our total cost. We run those, we calculate the benefits in that second grouping right below, calculate the taxes right next to it, and now we know how much cost we need to pay for all of the staffing. Those costs go together, and then below it, we calculate all those operational costs. And then we can take those and then now know per worker, a yearly FTE would cost this amount of money in the DCYF model. I think that this is what you might be seeing in the future, some version of this. And so I think that's why we wanted to make sure to jump from what PCG's been doing and then end in this spot. Any questions? I move very quickly, so I do not mind going back to anything. Thank you so much. I really appreciate the opportunity to come and talk with you today.
All right. Thank you, Jeremy. All right, so we've got a couple more informational slides about our model update, really the review of initial model enhancements, what is in the scope of work for us, PCG, and what is not in the scope of work for us. So what we are doing, what Public Consulting Group is doing, we're looking at one model budget for each combined in-home service. I see a hand up. Go ahead, Jamie.
Yeah, sorry, it's a lot of information to try
Fair
to
enough. Yeah.
take in really fast. I was curious why in that last table, it was 10% was for the supervisor, but we were using, that was based off a 7-to-1 ratio. I'm just wondering if I'm misunderstanding that.
Oh, those numbers are just thrown in. I apologize for having
Oh.
bad numbers in there.
Got
Yeah,
it.
I
Okay.
apologize. Yeah, it's just a form. We have to.
Placeholder.
Yeah, I apologize. Yeah.
No problem. Thanks.
Oh, Charlotte, go for it. Charlotte, you are on mute if you are talking.
Thank you so much. I was on mute and I was talking. My lips were moving. I just was a little shocked at the low cost of staff health insurance that you proposed, which was, I don't know, $5. I just want you to know, if just for regular old Kaiser, it's now running $800 a month per employee. So $5,000 a year. It's for, at least for our state, isn't working for me. So
Thank you. I appreciate that. We'll keep that noted.
thank you.
Jamie, is that a new hand? Hand up?
No, I was just trying to get it down. Sorry.
No, don't worry, it's all good. Okay, any checking the chat? Okay, all right, let's go back to where we were. All right, so what we are doing, what PCG is doing, we are going to create one model budget per community, or per combined in-home service. We'll be updating the staff salaries. We'll be evaluating the operating expenses. We're going to add in motivational interviewing, training, and costs to the FPS model, and we'll adjust travel costs in combined in-home models. So just reiterating what Jeremy had said, that's what's in scope for us in this project. What's out of scope, what we're not doing, we're not looking at supervisor staffing ratios and calculated FTEs, those leadership ratios and calculated FTEs that Jeremy spoke to, benefit calculations, or updating child welfare and case-related hours for those evidence-based practices. That's out of our scope. We're not doing those things. Jill, go ahead.
Charlotte just asked, I think it was 5,000. That's out of your scope, and a number that DCYF is using, and it's inaccurate. And every time they do this, so are you carrying our message back, or how will that be considered?
Jeremy, I'll let you answer that one.
I will do my best to make the best case I can. I know that it's, like I said, it's officially out of scope. So DCYF can choose not to approach it, but I love being able to take my position and my opportunity with them to show them data that can say otherwise, and then they can have their conversations internally. But I do appreciate you pointing that out, because we would love to build a model in our work of what is the reality, and often data sources can lag. And so being able to assess and understand the reality of the situation is always helpful, and having that information is helpful to the agency as well.
So are we supposed to talk to Amber about this, or how? Sorry,
I would say go through.
Where does my advocacy go?
Officially, Amber, yes.
Yeah,
Okay.
that's a good point. Well, Amber, do you want to speak to that?
Officially, yes, I do. I appreciate the comments and the concern around the numbers accurately reflecting the reality. As far as next steps, I'll be honest, I don't know. So I will be consulting with Dalton and the team, but I hear where you're coming from for sure.
And so,
All right. Oh, go ahead.
I have a question. When you were looking at staff, could you go, is that a fake slide, the numbers you put in, or is that real information? I'm just wondering, are we building in sick leave, holiday, you know, annual leave into that rate of what it costs to have an employee?
Yes, so 208 hours of sick leave, holiday, and all of those kind of paid time off
Okay.
is included currently. Yes.
Okay, thank you.
So our next steps, PCG and DCYF, our team, we meet bi-weekly. We'll continue to do so to work through those deliverables that I mentioned at the top of the presentation. We are going to review the new model benchmarks with CIHS providers. So we will do that. Like I mentioned a moment ago, we're going to add in motivational interviewing training and costs to the FPS model and adjust travel costs in combined in-home models. We'll review and revise the updated workbook with DCYF based on your feedback. So Jeremy mentioned that at the beginning of the call, and then we'll facilitate a discussion with you once we've done that. So you'll hear from us again. The date is to be determined. I think we're going to follow up with you on that very soon, right, Amber? Yeah. Jill, go ahead.
So where does provider feedback fall in this? So you do all that work, and is the facilitating the final discussion, is that our opportunity to provide feedback, or at that point are we done?
It is. Jeremy, do you want to talk about the process, like how we're going to put the workbook together and send it out?
Yeah, so once we've worked with DCYF, so what our next step is to take this baseline data and really finalize it. We've provided DCYF with our theories and views and started to do some of those conversations. We'll finalize those models. Once we do that, we have to build out each individual service within combined in-home services, right? So once we've developed those, there's going to be probably a version of that last slide that I had where we go over what each of the elements is, the final amounts and the percentages and the dollars. And once those get developed, those will go out and then provide opportunity for feedback, both written and then within a stakeholder meeting of some sort, probably something along the lines of like this.
Yeah, so our hope and plan is that you get an email version, right, of the workbooks. You have an opportunity to look at them. You can provide feedback via email, and then we'll convene together so we can talk through feedback and your reaction to those a workbook per service, per combined in-home service. So any other questions or comments? That is the end of our presentation. So we are open to questions or comments right now.
I know somebody brought it up, but I think the travel thing could be really sticky and impact willingness to accept cases, and thinking about how if you're not going to get paid for driving to do them, if they're, you know, actually for me, that's not going to be so much of an issue because we mostly provide just really close to the reservation. But I know that's really impactful for a lot of agencies when they're in rural areas and having to drive, you know, pretty far to provide those services. So
Right.
that's something that I worry about. And like I said, the slides went fast. You're right. You're a fast
They did.
talker. So I'm trying to think, you know, were costs like cell phones on there? insurance that you have to have as a business, to liability insurance, all those things. I just want to make sure, because those sometimes are those hidden costs that aren't always thought about when you're building out things. So I'm sure that we'll see what you come up with, but is there at that time the ability to have discussions, or is it like, okay, we're turning this in 2 days, so this is kind of what we're going to go with? Because I'm not blaming you guys, but sometimes that happens. And so
Fair
I
enough,
just
yeah.
like,
Yeah.
Can I just add to Allison really quick? So liability insurance is also a place that they lowball unbelievably. So
Okay.
it would be great if that were an accurate number.
So Allison, thank you. I hear you on that front. So we're not telling you a timeline right now because we don't know it quite yet. We're convening full transparency this week to figure out what specifically our timeline is for next steps. We know that we're going to provide you with the updated workbook definitely before August 14th, right? When you have your next scheduled convening, probably long before then. But I hear what you're saying. You would like to have the workbooks for like a period of time where you can actually digest what they're saying, so you can come up with, be prepared and have questions to actually speak to the content when we convene again. Reasonable request. That makes sense, and I hear you. Thank you. Other questions?
No.
Okay. Well, Amber, will be sending out these materials, this presentation, so you can actually sit down and take a good look at it. And we mean it when we say we want to hear your feedback and your thoughts. So please send it to Amber, and she passes that information along to us. So you're very open to that.
Thank you.
All right. Well, that's all we have. Thank you all for your time.
Thank you.
Bye-bye.
Thank you.
Okay, I'm going to
Thanks,
stop the
Amber.
recording.
it was no reflection